California Edition. I'm Brad Pomerance, and we are joined by Hector de la Torre. He was a member of the California legislature, but he is currently the executive director of the Transamerica Center for Health Studies. You've been looking at the Affordable Care Act from the moment it passed, and we are now, we have essentially concluded the second cycle of the Affordable Care Act. What trends can you tell us about the Affordable Care Act? Let's start with California.
Well, in California, we had a slight increase in the number of marketplace participants, people who got insurance through the exchange, of about 200,000. The numbers will be settled here in short order, but about 200,000 increase from about 1.2 million last year to 1.4 million this year. It's a good increase. However, Florida has surpassed California as the #1 state for marketplace participants.
Which is surprising on two levels. Cover California had set a goal of 1.7 million, and they did not hit that goal. Query whether that goal was too ambitious. The other surprising statistic that you mentioned, Florida surpassing California, I mean, Florida, I think it's fair to say the state is not kind to the Affordable Care Act. I mean, they don't run their own exchange. They have not engaged in the expansion.
Nope.
So who's driving the bus in Florida to get these big numbers?
It's community groups, it's
Right.
providers that are pushing for this on a grassroots level. Here in California, we've put a lot of money into television commercials and other marketing activities. Clearly, the state is very supportive of the effort, and yet we haven't got the numbers of a state that doesn't really care.
So the similarities between California and Florida also focus on demographics. Both states have large Latino populations, different Latino subgroups, but be that as it may. Are we seeing strong numbers out of Florida as it relates to Latino sign up? Because remember, they don't have the expansion.
Yes.
So
we know the 2014 numbers. We don't have the 2015 numbers.
In terms of trends.
But last year, Florida and Texas, which is another state that did not embrace the Affordable Care Act, did about as well as a percentage of Latinos as California. And again, big difference in investment and outreach from California at the state level versus those two states that did not have gubernatorial support.
So are we wasting money with these massive ad campaigns? I mean, we've spent tens of millions. I mean, there was Tengo un Plan, which was a big ad campaign that went through. I mean, a lot of different specifically targeted campaigns.
I think as you make your way through, the easier to insure folks are going to come on board. And I think that's what we've seen. Through TV commercials, et cetera. The population we're talking about, the uninsured, that are uninsured after year 1, after year 2, are going to be harder to get. They know less. They're less informed about how all of this works. They don't know about the subsidies that are available to them based on income in the exchange.
How could they not know?
We've done surveys.
Tell us, I believe you. I'm not suggesting that.
That show that over half of the uninsured as of last year did not know how to get health insurance. A year in.
Even in California, with the massive advertising campaigns.
It still did not penetrate that audience. So the answer is you need face-to-face, person-to-person communication. A, that's very expensive. B, it's very time-consuming. We don't have that.
Let me ask you, though. I've seen some surveys, and there is some fear, not majority, not even plurality, amongst some Latino groups, that if they sign up for a plan, either through the expansion or Cover California, somehow their name is now in a database, and if they signed up, they're legal, they're citizens, and somehow that could impact their family, who may be undocumented.
I've heard this, but I mean that's on the margins.
It is on the margins.
Much like a lot of focus is placed on the Spanish language media. Well, in general terms, the rule of thumb for Latinos is only about 30% prefer to get their stuff in Spanish. So what's the other 70%? What are you doing for them? And again, that requires face-to-face, person-to-person contact.
What about, aside from the fear of immigration ramifications, the whole notion of, I don't want to get involved with the government? I came from El Salvador where the government killed my aunts and uncles. Is that
no? I think likely? I think again, with the majority of Latinos, it is a question of cost and understanding how this all works. they haven't had insurance before.
Right.
Most of the uninsured at this point have never had health insurance. And so if you've never had it, you're not familiar with premiums and deductibles and all of these terms that we're used to because
Right.
we've had it. So that is the challenge, much like lower income populations in general, or African Americans or other groups. Latinos are the least likely group to have employer-based insurance.
I read that,
Which
yes.
means that they have to go out and get it themselves. And that's a tough slog for folks who may not be aware of all their options.
That being said, Latinos are signing up, and so they are accessing medical care. And I understand that a study came out recently which indicated that the number of Latino doctors, and I would say Spanish-speaking Latino doctors, is not keeping up with population growth. And so that can present real challenges. I mean, look, second, third generation Latinos obviously speaking English, but you never know. There just may be a comfort zone in speaking when it comes to medical issues in your first language.
And cultural competence.
Right.
I was just speaking to a doctor recently who was working with a Southeast Asian patient and needed to hydrate that patient and gave them a glass of ice water. And the patient didn't take it.
Because ice?
Because they don't drink ice water. They drink
tap water.
Tap water, lukewarm water. And so he didn't know this whole time, and he was wondering what was going on. Why was this patient not doing what they were supposed to? The daughter of this patient comes in and sees the water and says, "Oh no, she's not going to drink that." And so, again, cultural competence, being aware of the nuances of different cultures.
But let's talk about cultural competence, because look, I mean, one can be of Latino descent and have no cultural competence.
Absolutely.
And so what do we do in that situation?
Well,
where,
in that situation,
Yeah.
what you're trying to do then is just have access. 11 million people have signed up for insurance plans through any of the states this year. We know that. Do
More than 11 million.
Do we have over 11 million patients worth of doctors in the system?
Well, not in California, especially in certain pockets.
And so that is the challenge, is about increasing the number of providers who can handle this newly insured wave that is coming into the system. That is our challenge overall. The Latino challenge is a subset of that.
Let's talk about the expansion. I'm fascinated in that slowly but surely, many Republican governors are looking to participate in the expansion. Also fascinated that many Republican governors are not getting the support from their legislatures often. And some of the reddest of red states, Republican governors are jumping on board. The Obama administration is trying to work with them to figure out a formula, but they're getting pushback.
Yeah. Well,
What's happening there?
It's two things. One, the governors are seeing that it's costing them quite a bit in their health infrastructure to have all these uninsured people using ERs, et cetera. So they're seeing the cost side, and they have a means to take care of it, which is to expand Medicaid, but they're having political problems. What is helping them is the chambers of commerce in those states. The chambers of commerce are saying, hey, a lot of these people who are caught in that hole are our employees. And now with the employer mandate kicking in 2015, they're saying, if you don't do this, then we have to cover them, and we don't want to. We can't afford it, et cetera. And so the chambers are pushing the politicians to do it in those states. You have a wonderful example in Arkansas, a red state, where they got around this political pushback by saying, we're not going to expand government, we're not going to expand Medicaid. We are going to expand the exchange, where people are going to get private insurance. And so what they did was move all of their Medicaid expansion folks into the exchange, where they could just get a health plan like everybody else.
His name is Hector de la Torre. My name is Brad Pomerance. It's California.